Death is a tragic reality and may affect not only adults but also children. In fact, thousands of children are um, dying each year, with accidents as a leading cause of death for children between ages of 1 and 14. In addition to that, the number one fatal disease in this age group is cancer. All these children will leave behind at least one family caregiver that is grieving, along with siblings and other family members. And as a nurse, we must be prepared to encounter um, and face um, dying and bereaving um, families. It is difficult to accept death, however, it is almost impossible to accept the death of a child. Caring for a family that is facing the death of a child uh, will call for a lot of your personal and professional skills as a nurse. It may ask you to be able to be sensitive and gentle, be able to provide physical care and comfort measures for the child, along with continual emotional support, not only for the child, but also for the family, for the caregiver, and the siblings. Any type of chronic condition, and especially a terminal illness, will create a family crisis. And as a result of that, the family may be destroyed or strengthened as a unit. Um, and as well, the caregiver and part of the family may become stronger or weaker. It is essential for a nurse to be knowledgeable, sensitive, and able to provide meaningful care for both the child and the family that is mourning. It is okay to be uncomfortable with the idea of death um, because you're coming from a point of view of healing and treating. And a lot of times, um, the healthcare workers are uncomfortable around dying patients and they are trying to avoid them and they are afraid that the patients will ask direct questions that the healthcare giver will not going to be able or cannot um, answer. So when we're exploring all our feelings, we must understand what exists behind our inability to face it. Um, why do we try to avoid the fact um, that we need to take care um, of a dying patient? And when we are exploring this type of feelings, most of us will find out that facing death reminds us of our own mortality. And that makes every single one of us very uncomfortable. Um, we all want to stay younger and we don't like to feel vulnerable. We need to explore our feelings and um, just reevaluate how do we feel about life and death. There will be questions as how do I react to the death of a friend? How do I react to the death of one of my family members? Um, when I was growing up, was I talking and thinking about death? Um, was I admitting that death is part of the life? So learning to care for the dying patients requires also involving and talking with other professionals. You can share your concern. You can comfort each other because caring for a dying patient can be very stressful. You may want to look into studies um, that talk about death and discover how dying patients may feel about their care, may feel about their illness. Um, how do they cope with that? It requires you to be sensitive and empathic and definitely not judgmental. and to become a very good listener, both to the patient and the family. Caring for a dying patient is usually a team effort and may involve the nurse, the healthcare provider, a religious leader, social workers, psychiatrist, hospice nurse, and a lot of times what is called a thanologist. That's a person that usually is a nurse that has special training on working with dying patients and their families. We'll need to discuss now the child's understanding of death, and there will be a few factors that may affect the child's ability to understand death. And those will be his or she stage of development, their cognitive abilities, their previous experiences, how the family deals with the death. And keep in mind that most of the children do not understand how final the death is. And this understanding will not come um, up to the point that they will reach the pre-adolescence. When we are dealing with a child's anxieties related to death, we need to have to be open and honest in order to have to gain their trust and to have them at a certain level of comfort. In terms of their developmental stages, infants and toddlers have very little understanding of death. Um, the toddler fears the separation from a caregiver, but do not have the recognition of the fact that the death is irreversible. A toddler has a way of expressing death as grandma's gone bye bye to be with God, or grandpa went to heaven, and just minutes later to ask because they want to visit the deceased person. Um, that's a good opportunity over there to explain to them that the person that's dead, that it's either the grandparent or a parent, is in a special place and they cannot be visited. However, the family, and they have many memories and they can treasure that and they can reminisce on that. And most questions should be answered very simply and honestly, based on the level of understanding of the child. Moving forward in the preschool child, they have what is called an egocentric thinking, and um, they see themselves in the center of every situation. They do not see the surrounding environment, but they see themselves in the environment. And as a result of that, they may have beliefs that um, they can think that just because they thought something wrong or they were angry, they may cause the person or pet to die. They may have what is called magical thinking at this stage, and that's a big part in the way that they build their beliefs about death. So it's not unusual for a preschool child to insist on burying a dead pet or bird, and a few hours later to just dig up the corpse to just see if they're still there. Many preschoolers think of death as kind of a sleep. They don't have, a lot of them don't have to understand that someone that is dead will not gonna wake up. And because of that, at a certain point, they may become extremely afraid to go to sleep after the death of a close family member because they will be afraid that they will not gonna wake up. In this kind of situations, we need to educate the family on how to encourage the child to talk about their fears, and how to reassure them that nothing would happen while they're sleeping. And the child's feeling must be acknowledged as real, um, as in order to help the child by doing that to resolve them. In some other cases, a preschool child may view a personal illness as a punishment for their thoughts or actions. Um, Therefore, we need to provide security and comfort by explaining that that's not what happened and what's the um, real reason for the condition. The school-age children, and especially after the age of 9, they start to gain the concept that death is universal and irreversible. Um, Depending on their level of education and understanding, um, they may look into that as um, have the death as being personified. Um, they can see it as God or the devil or a monster. They also they have this kind of belief that they can protect themselves from death by running past the cemetery while holding their breath, or keeping doors locked, or staying out of dark rooms. They have this kind of um, magical type of thinking. When facing the prospect of their own death, they usually have a sadness. And mainly this is because they believe that they will leave their families and people that they love. They may fear the loss of control. And this is because death represents to them, and they will express their fear in sometimes in a vocal aggression. A, Again, for this type of conditions, we need to educate the family in terms of helping the child to voice their anxiety about present or future, and provide an outlet for all those aggressive feelings. Moving into the next category, the adolescents have a more adult understanding of death. However, at this stage, they feel that they are immortal. Nothing can happen to them. No wrong can be done. And because of that, they may be involved in dangerous and life-threatening behaviors. Um, Whenever we need to give a diagnosis of a life-threatening or a terminal illness um, to an adolescent, that may um, start a crisis. Um, to cope with an illness, the adolescents need to reach for some cognitive functions, some past experience, and have the problem-solving ability. Therefore, in a terminal illness in an adolescent, we may see helplessness and anger and fear of pain and depression. They may be upset by the result of the treatments that may leave them feeling weak, or they may change their appearance. In some cases, can be alopecia or edema from steroid treatments. Um, that's why they need a lot of assistance in uh, by acknowledging their feelings, and also to be offered the opportunity to acknowledge their own impending death. An 8-year-old child is actively dying from leukemia. What could you, as the nurse, do to help the child and his or her family? A. Recognize that vocal aggression is an expression of child's fear. B. Recognize that vocal aggression is an expression of child's sadness. C. Teach the family to maintain discipline with the child. Or D. Teach the family to give the child whatever they want. The answer is A. Recognize that vocal aggression is an expression of child fear. The death of a child will create um, a shock and disbelief and guilt um, through an entire family. And the family members will go through the stages of grieving process as denial and isolation, anger, bargain, depression, and acute grief, and finally acceptance. However, not every child or family will complete the process, because every single individual and each family, as well as each death event, is very personal and unique. And this is where the anticipatory grief concept comes in. This is a phenomenon that happens when death is expected, as in a terminal illness, when the family begins to mourn in anticipation of death. In some cases and some people, this will shorten the period of acute grief and loss after the child's death. In most cases, anticipatory grief begins when a potential fatal disease, let's say leukemia or other type of cancer, is diagnosed and will continue until remission or death. When there is a rapid advance of the disease, this anticipatory grief may be very short-lived because the child's death is very near. In cases of an accidental or sudden death, the family has no time to anticipate or to begin the grieving of the loss of the child. Therefore, the grief may last longer and be more difficult to resolve. So the grief for the death of a child is not limited in time and may continue for many years. And in some cases, professional counseling is necessary to help to work through the grief. The support of others who experience the same sort of loss can be helpful. And there are two national organizations that are founded to offer support, and those are the American Childhood Cancer Organization and the Compassionate Friends. There are two situations that a family needs to cope with dying and death, and that can be when um, it will follow a terminal illness or when that is sudden and unexpected. Whenever there is a terminal illness, the family caregivers um, that are taking care of a child in the final stages of a terminal illness need to cope with sometimes many hospital admissions. Um, During these times, the family may need to make decisions about the child's physical care, um, as well as coping and starting to live with the idea that they have a dying child. Along with the child's condition that deteriorates, um, it is a good idea to encourage the family to talk to their child about dying. And that can be very difficult for most of the families and also for most of the nurses. Um, Based on their religious beliefs um, and by their personal convictions, they may find support in a religious counselor, in a hospice nurse, in a social service, or a psychiatric worker. We are trying to provide the child with as much normalcy as possible inside the child's schedule. And if it's possible, school attendance and even special trips should be encouraged as long as the child is capable and desire to do that. Keep in mind that during all this process, the family will go through the process of grieving, including anger and depression and ambivalence and bargaining over and over again. As a result of that, sometimes the caregivers may direct anger at the hospital staff or themselves because of the guilt, or each other, or even the child. We must reassure the caregivers that those are normal reactions. And whenever we can, um, just explain them that we are not taking sides. Whenever the child is improving enough to go home, um, the parents may find themselves overprotecting the child, especially in those chronic conditions that have relapses. And as a result of that, um, a codependency is developed. So the child will learn to manipulate the family members only um, to find out that that will not going to bring positive results. When the child is returning to the hospital because of an attack or an increasing in the symptoms, the family will again go through the same grieving process. When death comes, it's perfectly appropriate to share, for you as a nurse, to share the family grief and crying with them um, or giving the privacy to express their sorrow. Whenever you stay with the family, it is advisable to stay quiet and supportive, having the attitude of a comforting listener. Appropriate statements to say will be, "I'm so sorry," or "This is a very sad time." The main focus needs to be on the family's grief and on what you can do to support them. If the family wants to hold the child to say a final goodbye, this should be encouraged. IV lines and other equipment that can be removed to make holding the child easier should be removed. Family may be left alone during this time if they desire. Whenever there is a sudden or unexpected death, The family was not able to prepare for that as they could if the child, let's say, would have had a terminal illness. So they do not have the opportunity to complete any unfinished businesses or go through any anticipatory grief. As a result of that, the family may have excessive guilt and remorse for something they felt they left unsaid or undone. Um, the family must be given the opportunity to see and hold the child, even if that happened through a traumatic death with disfigurement. However, you need to prepare the family for seeing the child, explaining why parts of the body might be covered. Being the child, even in the presence of severely mutilated bodies, will help the family to have a realistic view of the child and is helping them in the grieving process. Unfortunately, in this situation, the family might need to take a number of decisions that need to be done rather quick, um, and they need to make plans, and the decisions may involve organ donation, funeral arrangements, autopsy if desired. Um, all those need to be discussed um, by designated persons. Um, let's say if the hospital has an organ donor coordinator, this is the person that needs to do all the discussions. The family needs to be well informed and must be supported through any type of difficult decision they may need to take. From the child's point of view, there is a child reaction to a terminal illness, and they also experience what is called anticipatory grief. Even a young child um, becomes aware of the seriousness of their illness, and this is mainly based on the actions and emotions of the people around them. So they realize that he or she is going to die and that there is no cure for him. And as a result of that, sadness and depressions are very common. The child may become fearful about dying and also may become concerned of what will happen with their family members. So we need to allow the child to talk about their feelings and to support them with honesty and provide answers to every question they may have regarding the illness or the treatment or the prognosis. They may feel fear that pain is part of the death, and for in this situation, they should be reassured that medication will be used to control the pain and keep them comfortable. The dying child may have a decreased level of consciousness, however, the hearing remains intact, and if the family members are at the bedside, um, we need to let them know about that and make sure that nothing, um, we are not seeing anything that we would not like the child to hear if they were fully conscious. Gentle touching and caressing are always comforting. As death approaches and the internal body will increase, um, therefore the dying patients most of the time may be unaware of the cold, even though their skin feels cold. Um, so we need to explain the family so they don't think that the child needs additional covering. There is a restlessness just before death, and that's need to be explained also to the family. Sibling reactions. Um, the siblings of a child that is dying of a terminal illness, um, they also go through an anticipatory grief, and in addition to that, may feel confused and lonely and frightened about the sudden loss of a sibling. There will be changes in the atmosphere in the household, and that can be upsetting. Um, as as it happens with children that have chronic conditions, the siblings that are healthy will resent the attention that is given to the ill child, and they will be angry about the disruption in the family. Whenever is possible, we need to explain to the siblings and to acknowledge their feeling. And sometimes some of their behavior may be incorrectly labeled as learning disability or behavioral or behavioral disorder, um, and that can happen especially if the school personnel are unaware of the family situation. When the child dies, especially if the siblings are younger and they are in a magical thinking stage, they may feel guilty, especially if there was a certain rivalry existed between the children before the illness. Regarding a sibling that should or should not attend a funeral service, this decision can be difficult. Um, the current thinking in the medical field currently supports the presence of the sibling. Um, the sibling may be encouraged to leave a token of love or a goodbye, like a note or a toy or um, drawing some kind of special memento. Siblings can visit the uh, the dead child in privacy with a few other mourners present, and that will allow the sibling to deal with the reality in an open and honest way. Question number 3. Tell whether the following statement is true or false. Healthcare staff can meet the dying child's needs more effectively if the family caregiver allows the child to know that he or she is dying. If caregivers permit openness and honesty in communication with the dying child, the healthcare staff can meet the child's needs more effectively, dispel misunderstanding, and see that the child and the family are able to resolve any problems or unfinished business. There are several options in order to setting for care of the dying child. Uh, I will start by talking about the hospice care. And hospice care starts back in the day when the hospice was that place of refuge for travelers in the medieval times. Um, Later, um, in the first hospice in U.S. was the New Haven Hospice in Connecticut. And now some programs offer hospice settings to which patients can go during their terminal stages of illness. Um, and those this setup will provide support and guidance for both the patient and the family. Um, in other situations, those hospices may provide help even if the patient will stay home. In terms of home care, the home care for both young and old dying patients is increasingly common in the recent years, and more families are choosing to keep, especially the children, at home during the terminal stages of illness. And a few elements may contribute to this decision. One will be the concern about the cost for hospitalization and all those non-medical expenses associated with family traveling and housing and food. The second one will be the stress from repeated family separation when the child is in a hospital or hospice care. And the third will be the loss of control over the care of the child and the family life that a lot of families will still want to have at least towards the end. Families feel that the more loving and caring environment um, the home can offer, um, the easier will be to go through the grieving stages and will reduce the guilt that the family is feeling. There are some disadvantages, however, of the home care. Um, the cost that would have been covered by a health insurance that is hospitalized now will be covered by the household. And caring for a dying child can be sometimes very difficult emotionally and physically. Not every family um, can have a dedicated person that can carry out some procedures that need to be performed regularly. And in some instances, home nurse assistance um, will will be needed. Usually, the home care nurse um, have may be able to visit several days a week or can be on call if needed. Deciding whether or not to care for a dying child at home can be extremely difficult for the family, and the families may need a lot of support and guidance in the process of making this decision. The hospital care um, has both advantages and disadvantages. The family and the child may have a lot of support in this type of situation. Um, However, the hospital care is much more expensive and may be prohibitive for many families, especially those with no health insurance or low coverage health insurance. However, in our society, the hospital is still culturally accepted place to die. As a nurse, please remember that you have a colossal important role in providing both physical care for the child and emotional care both for the child and the family. The information that you will need to provide need to be clear and simple in an honest and open way of communication. Um, Always encourage both the child and the family to share their feelings and reactions regarding any situation and to ask any questions they may have. You can be supported by listening and providing appropriate interventions. Now whether the following statement is true or false. The assessment is performed by the healthcare team and only covers the family support system, present indication of grieving as anticipatory grief, and interactions among family members. The answer is false. The assessment is performed by healthcare team and covers the child's developmental level, the influence of cultural and spiritual concerns, and the family support system, present indication of grieving as anticipatory grief, interactions among family members, and